Okay, so we are going to go over how to help seniors remain in their homes today. We are going to go over some different types of in-home supports, why seniors want to stay in their own homes, and when do you think that your parents need more help in their homes, as well as how to get them on board for having some help in their home, because we know that could be one of the most challenging parts of all of this, and we will have some time for questions afterwards. But first, we're going to go over a little bit more about Elder Help and us here. So Carrie is going to explain.
Hi, good morning. I'm Carrie McClellan. I'm the Outreach Manager here at Elder Help. And our mission here at our organization is to provide personalized services and information that help seniors remain living in their own homes with dignity and independently. And that's something that's really important to us. And it's also a lot of times the seniors' mission. Everybody wants to stay in their own home, in their own community where they feel the most comfortable and what's most familiar to them. All of the programs that we have through Elder Help are really intended to reduce social isolation. So we talk about that quite a bit, and the importance of staying connected and staying, having those relationships with other people and making sure that all of the resources that somebody does have is able to allow them to stay living more safely in their own home. And now Dana is going to go into the rest.
So, and I don't know if I said in the beginning, but I'm Dana Gerard here with Elder Help. As most of you know, I saw a couple people still are joining in, so I just wanted to remind you guys that if you do have questions, go ahead and send it in the chat box here, and we will be sure to address those. So why do seniors want to stay in their home, and how can they do that by being safe? First of all, most seniors want to stay in their own homes because their biggest fear is losing their independence. Staying home is one of the ways that it lessens that fear, and according to the AARP, 90% of seniors want to age in their own home. Another reason that they really want to do that is that it lessens their fear of abuse and neglect, and it's just a familiar place to them. So be sure to talk to them and ask them why it's so important for them to stay in their own homes. Maybe they want to keep a pet, still have visitors, and maybe it's just the opposite. Maybe they do want to downsize and move to a new city, but maybe they still want to do that by living independently, so they don't want to go into a living facility. They still want to live in like an apartment or a condo, or maybe just a smaller home. And it's important to keep in mind that typically staying in your own home does cost less. It costs about 20% less than what a typical nursing home costs in a month. So a lot of the times you can get a lot of in-home care services for the amount or for less than the amount of what it costs to go outside of your home, live outside your home. So I think it's important to go over a term, aging in place, because it is a common referred to term when talking about aging at home. And it is defined by the CDC as the ability to live in your own home and community safely and independently and comfortably, regardless of age, income, or ability level. So when do your parents need more help staying in their own homes? Once their eating habits are starting to become poor, so this could be different things like dehydration, they're starting to lose some unexpected weight or unintentionally losing weight. They are not eating healthy foods. Maybe they're eating a lot of convenience foods and more like snacking rather than eating a whole meal. Or maybe you're going over to their home and their food in their refrigerator and pantry are expiring, and you know that's not safe for them because they can get sick from that. And they could be doing these different things because it could be hard for them to grip utensils when either eating or cooking. It could be hard for them to read a recipe. And something that's really common for seniors is them losing their sense of smell, which leads to losing their sense of taste. So they just don't have an appetite for eating anymore. Maybe they're starting to fall, or they are becoming a fall risk. So the biggest risk of falling comes after another fall, if they've had a fall in the last year. or if they have recently been diagnosed with something, maybe like vertigo, where they don't have as much balance. A sign of falls is usually when someone starts to walk around their house and grab furniture to stay steady. Usually this means that they've either had a fall recently or they're very afraid of falling. And this is something that a lot of seniors will keep from telling people because they're embarrassed by it and they think that they're going to have to leave their home because of it. If their bathroom or personal hygiene is going down, so that would be their hair is really dirty or uncombed, they're wearing the same outfit over and over, not doing laundry anymore, not brushing their teeth, or this is also including things like incontinence, not being able to use the bathroom anymore, wetting the bed frequently, wetting their pants frequently. And again, this is something really embarrassing to a lot of people. They don't want to share about it, but it's something to definitely check on with your parents. Cluttered house, dirty house, so laundry's piling up, dishes are piling up, they're not taking the trash out, they're not checking their mail. Some of those tasks can be really hard for them, especially if they're a fall risk. They don't want to be carrying the garbage out. They have unexplained bruises, cuts, bumps, scrapes. They're forgetting things, and they're forgetting important things like doctor's appointments, taking their medications. They are forgetting where they are when either they're driving in a familiar place or walking around the neighborhood. They are forgetting things that are out of the ordinary. So this isn't just forgetting where they put their glasses or their keys or their remote control. Forgetting important things that is out of the ordinary for them. They're having trouble managing their money. They're spending money that they don't have, or they're doing some unusual money spending habits. They are not paying their bills, or they're having some bounced checks come back to them, or they're getting calls from collectors. Medication misuse, so this could be forgetting to take their medications. It could be not being able to sort their medications anymore. It also could be taking expired or unneeded medications, or just they forgot they took their medication in the morning, so they're taking another dose again. And personal safety, which I believe is the most important. So they either cannot identify what a smoke alarm or a CO2 alarm would be for anymore, or just signs of smoke, which could lead to a fire. They are answering the door for people that may be inappropriate or letting them into their home, or they're forgetting where hidden keys are located or what a garage code is. And most importantly, you need to make sure that a senior knows how to call 911 or get out of their home in case of a real emergency. If someone's not able to do this, this is definitely a sign that they cannot be in their home anymore, or at least in their home alone anymore. And just keep in mind with all of these things, it's embarrassing for a lot of these things to start for them, and they may not want to tell you because, again, they are afraid of losing that independence of being in their own home. So some types of services that are available for parents in their own home. These are the different in-home care services that we're going to be going over, everything from simple in-home care to going maybe to an adult daycare, which is a place that can keep them in their home for longer. So in-home care is a service that is provided by a caregiver that comes to the home, and this caregiver can either be through an agency or an independent person. This can also include live-in caregivers. The services that they provide can include light housekeeping, meal preparation, transportation and errands, bathing, dressing, medication reminders, or even just some companionship. So someone that could take your mom or dad out for lunch or to a movie, get their nails done, their hair done. It's important to know that in California, agencies that are not referral agencies must be licensed as a home care organization. So often they're referred to as a home care agency, but just when you're making calls for your mom or dad, be sure that you're asking that question and be sure that they are licensed and credited. Usually in-home care is a private pay service, but it can be paid for sometimes through Medi-Cal, the VA, or long-term care insurance, and it is always, or not always, but usually charged for by the hour. There are some benefits of hiring an agency versus a private caregiver, which we will go over in just a minute. But the biggest benefit of hiring an agency is definitely that they can provide a backup caregiver if your regular caregiver is sick. Caregivers that are provided through an agency usually are not CNA trained or other skilled worker trained, so they cannot administer or sort medications, they cannot do wound care, and they cannot monitor any mental health or health diagnosis. But when you're hiring an in-home care agency, it's just important to let them know what your expectations are and what you need from them so that you're having an open and honest conversation and finding the right provider for you. So hiring a caregiver and an agency, like I said, be sure to ask the questions that are based off your loved one's needs. Be sure to ask the in-home care agency if they are licensed in the state of California under a home care organization. And this is specific to the state of California, that terminology of home care organization, but keep in mind if you are looking in other states, it is very common for in-home care to need licensure. Just depends on the state. Going off of licensure, be sure to ask them if their employees are insured and bonded. How do they find their employees? How do they train them? If they hire CNAs, if they don't hire CNAs. If you are hiring someone on privately, it is important to ask if they have a CNA so that way you know they have that proper training to take care of your mom or dad. Know how their billing is done and if there are extra fees for services. So a common place that you can get an extra fee from is bathing, as well as if you're doing overnight care, if your mom or dad gets up multiple times in the middle of the night. If you're going through an agency, ask them how quickly can they find a replacement if your regular caregiver is sick. And ask if they do bill per service or by the hour. Be aware if you are hiring privately of live-in caregiver laws as well as tax laws, having insurance for them. Sometimes this is covered just under homeowners insurance, but it's important to know in case that person does get injured on the job. And if you are hiring privately, be sure to have a backup plan for if that person is sick. So this many times does fall back on the family to fill in, or even if that person does quit unexpectedly. So home health and in-home care are two terms that are often confused and mixed up. So it's important to know the difference between the two. Home health is a clinical medical care service, so a skilled service, and this is provided by either a nurse, a physical therapist, occupational or speech therapist. Oftentimes it is a combination of all of those skills, just depending on what your loved one needs. And most often it does follow a hospital, rehab, or skilled nursing stay, and it does need to be doctor ordered. So usually it is just through your medical group that the doctor will order your stay. I see the question. This is important. That what does CNA stand for? It stands for a certified nursing assistant. I had to think about it. It's such a common phrase. I had to think about it for a second. Certified nursing assistant. So they do have to go through trainings to get that certification. So it's not as much as a nurse, but they are obviously a nursing assistant. So they are often who, when you are in the hospital, they're doing those hands-on care for you, like bathing and changing the dressings of wounds, changing your sheets, things like that. So good question. Thank you for asking that. Home health does include different things like therapy, administration and management of medications and injections, monitoring medical diagnoses, pain management, and wound care. So these are all skills that can be done in your home. And most often, home health is paid for by either Medicare or Medi-Cal or Medicaid, depending on where you are. Very rarely is it private pay. I've heard of it a few times, but it's kind of a case-by-case basis. That's not very commonly used. Home delivered meals. So I'm sure a lot of you know about home delivered meals, but they do promote healthy eating and usually focus on areas of nutrition that seniors need the most. So common ones are like Meals on Wheels and Mom's Meals. Those are geared towards senior needs, and usually those have little to no preparation. They come either ready to eat or just need to be warmed up in the microwave for a little bit. But another good option is either these new meal prep companies or delivered ingredients. So those are like Blue Apron and HelloFresh, and they just come with all of the ingredients chopped up, and your loved one would just need to read a recipe on how to prepare it. So again, just going back to what your loved one needs, can they still read recipes, use utensils? Is it safe for them to use the stove? But it could be a great alternative to going to the grocery store or needing to chop up vegetables, fine motor skills. So usually they can be either paid for by meal, weekly, or monthly. It just depends on the service that you are using. And they can range anywhere from a couple meals a week, so that's usually just like lunch or dinner, or 3 meals a day, 7 days a week, just depending on the service that you are using. And they can be delivered either fresh or frozen, again, depending on the service. So when you're picking a service, just be sure to consider any dietary needs that you or your loved one has. So are you vegetarian? You need low sodium. And you can always ask for a trial. A lot of these places do have where you don't have to commit to anything. Personal emergency response systems. So these are the personal help buttons that can be pushed in any kind of emergency. I always like to point out with these that this doesn't have to be a fall or a medical emergency. Usually these are hooked up to just 911 dispatch, so you can use them for like fire or police as well. It's also important to know that with a lot of these, you can usually contact friends, family, or neighbors before you contact emergency services. So mom or dad can press this button to say, I'm just not feeling well and I just need to call my daughter, rather than I'm not feeling well and need to take an ambulance to the hospital. These are especially really great for people who are a fall risk and are at home for either part or the whole day by themselves if they live alone. They are really great alternatives to keep people in their home longer and make them feel safe as well. And ultimately, if somebody feels safe when they have one of these, they're going to be more independent and up and about and not feel like they're confined to the chair or the bed, keeping them stronger. Usually these are billed monthly and they are mostly private pay. They can sometimes be paid for by Medi-Cal or Medicaid, again, just depending on where you are and the type of sub-services that you receive under that. Some of them can detect falls or have a GPS service in them. And some different things to consider when buying one of these systems or buttons is, number one, is it waterproof? I think this is one of the most important things to consider because 60% of falls do happen in the bathroom. So mom or dad should not have to take this off when they are showering because showers are very dangerous for older people. Does it need to be charged? Again, another really important factor because mostly people do their charging of these overnight. And then they get up in the middle of the night to go to the bathroom and they don't turn on the lights, or they're groggy and they have a fall in the bathroom and they don't have their button, which is what they are supposed to be having it for. So try to get a button that doesn't need to be charged. The reliability and responsiveness of the system. So is the call center open 24 hours a day, 7 days a week, 365 days a year? Super important. Falls happen every day of the year. Can the unit detect a power outage, and does it have a battery backup in case of that? If your loved one doesn't have a landline phone, can it be used on a cell phone service? And what is the cell phone service that it's used on? So is it a cell phone service that has a lot of reception in your loved one's home, or is it a cell phone service that you've never heard of? You should not have to sign a contract with these, just in case somebody does have to move unexpectedly, go to the hospital, stay in rehab unexpectedly. And you also should not have to pay per press of the button, and you should not have to pay separately for the button and the receiver. It should just come together in one monthly fee package. And just make sure you're addressing any hidden costs that are associated with these buttons. And another really important thing is, how far of a range does this button have from the receiver? So if you have a basement or a second floor, again, stairs are really dangerous. So you want to make sure that they work in those places, or even just like walking to the mailbox, make sure that it still works. Transportation. So we all know that you guys are mostly employed, so you can't take time out of your day to go be driving your loved one to appointments. There are many different transportation services that are available just depending on your needs. It's always great to check with either your insurance agency and or your hospital because they sometimes offer medical transportation to appointments. Same with support groups. So if your loved one does go to some kind of support group, sometimes they offer transportation or maybe somebody else in the support group can help them with getting there. Volunteer organizations such as Elder Help, we provide transportation, and Lyft and Uber are now really great alternatives for seniors as well, where maybe you can order it for them and just give them a call to say, hey, your Lyft is going to be there in 5 minutes. This is the type of car that they are driving, and then it's a cheap alternative to a taxi, and you just know that they got there safely. Public transportation is sometimes forgotten about too as an option. Just be sure to check with transportation agencies. How far in advance do they need notification for rides? So, Lyft and Uber, that is a service that is on demand, but maybe some places may need 24 hours to up to a week's notice, just depending on the organization. And also be sure to check if they are wheelchair compatible. If your loved one is in a wheelchair, that is a common thing that is not offered. And if your loved one does need more than door-to-door service, do they offer things like staying with your loved one during the appointment or getting them through the door into the waiting room, things like that. Geriatric case managers, these are usually looked over because they cost money. But they are a professional who is trained to help manage or help a senior's care. So usually they're privately paid for, and they can be anywhere from about $50 to $200 an hour, which sounds like a lot of money, but ultimately they can help you with saving money because they are going to give you the best solutions ahead of time and know what is important to you and your loved one and your family. So these are really great for people who are arranging care from a distance because they know of local resources. But they can also just be an advocate or an extra set of hands to help you manage the senior healthcare world. So maybe you don't need them, for a ton of hours, but just a couple hours to know what's available for you and your family. Sometimes they can attend doctor's appointments, help you communicate with professionals. So if that's something that maybe is intimidating to you, or you just don't know how to talk to some doctors or terminology that you should use to get the best care for your loved one, they can help with that. The best place to find a geriatric case manager is either through your local area agency on aging or the National Association of Professional Geriatric Care Managers. Mouthful. And a PACE program. So a PACE program is a program of all-inclusive care for the elderly. They can be provided by an interdisciplinary team of health professionals wherever the patient calls home. And some of the services that are provided under the PACE program include a primary care physician, adult daycare, physical therapy, occupational therapy, a social worker, home health, personal cares, prescriptions, some medical or most medical specialties, respite care, nursing home, and hospital stays. To be part of a PACE program, you do need to be eligible for nursing home care, and you are eligible for a PACE program under Medicare or Medi-Cal, and sometimes you can pay for PACE programs privately. In San Diego, the PACE program is through St. Paul's PACE, which is through St. Paul Senior Services, and they are located in downtown San Diego, Chula Vista, and soon in El Cajon. And lastly, senior centers and adult day centers. So these two programs are similar, so I put them together, but they do have their differences. They both have a very wide variety of programs that just varies by the center. So usually they have a lot of socialization. Sometimes they have meals, crafts, different activities, games, speakers, health and fitness programs, education, different things. Just depends on the senior center or adult day center. Senior centers are typically free through either your city or your county, but adult day does have a fee. Typically, adult day is more for somebody with medical needs or dementia, but it is a program, that can help keep someone in their home. So this would be something usually someone goes to while their loved one is at work. So adult day centers usually can take care of things like incontinence care, remind of medications, and have a nurse on staff. But be sure to discuss costs of that. So is there extra charge for incontinence care? Can they provide transportation for you? What are the qualifications of the staff? Adult day centers, also be sure to ask, is the building secured? Is the outdoor space secured? And with both senior centers and adult day centers, are guests required to sign in and out, or can anybody just go into these buildings and have fun with your senior? Adult day, like I said, typically has more supervision and a higher level of care. With both senior centers and adult day centers, you can ask for a one-day visit and try it out. Make sure it's the right fit for you and your loved one. So who pays for these services? I talked mostly in each individual slide about who pays for these services, but there could be some confusion on what these different funding sources mean. So Medicare is a program that is for seniors 65 and older. Medicare only covers short-term care, so this is either short-term rehab after a hospital stay or rehab at home. It does cover hospital stays as well, but it does not cover either assisted living or residential care or in-home care. Medi-Cal and Medicaid, those are financially based. It just varies by state what the requirements are for eligibility, but they can cover assisted living, residential living, and in-home care. And then the VA, if your senior is a veteran, just be sure to check with your VA care coordinator. Most VA programs are means tested. Long-term care insurance, usually people know if they have long-term care insurance because it's something that they signed up for as a benefit through work or just sought out to sign up on their own. It just depends on the company and the policy that you signed up for on what you are eligible for. And then some other options are reverse mortgages and annuities, but it's just important to talk to your loved one in what works for you and your family when you are looking into these solutions. So one of the most challenging pieces of in-home care is getting your loved one on board. So it's important to know how to start the conversation. If you can, start the conversation early when somebody is still healthy, when they can still live in their own home. Make sure it's just not too late. It doesn't have to be a conversation that you sit down and have over one dinner. Decision doesn't have to be made right away. It can be a progression. Use positive language and empathy. Talk about benefits. So rather than saying something about moving, talk about the benefits of staying in your own home. Talk about the cost benefits or maybe one-on-one attention. Know the options. So know what the difference is between in-home care and moving, and bring that up to your seniors. So maybe in-home care really isn't something that sounds appealing to them. Also bring up things about what if one spouse gets sick before the other, or finances as well. We want to make sure that this is something that is cost efficient and can last somebody throughout their life. If someone has a diagnosis, know the progression of that diagnosis. It's important that someone gets a diagnosis, that they are involved in their care and their options. Know that if you have to make a decision within 6 months to a year, that they're involved in that decision. Focus on independence. So you want to bring up the fact of, well, what if you fall and then you have to go to the hospital and go to a rehab stay, or these are the consequences if you do start to forget and stop taking your medications or stop going to the doctor or your appointments. Sometimes it helps to just make it about you. So say that you care about them and why it's important to you, and you're worried you cannot continue to be taking time out of your day and out of your busy schedule to take care of them. And most importantly, just be sure to emphasize and listen, validate their feelings, listen to their concerns. And lastly, home modification. So sometimes all it takes is making someone's home a little bit safer so that they can stay there for longer, or just to prevent a fall. So make sure that there's plenty of lighting and, no shadows that can cause someone to trip over something or not see where they're going. Sometimes installing railings or grab bars, making sure that the stairs railing is properly in place, grab bars in the shower, handheld shower heads, walk-in tubs are really good solutions in the bathroom, and remove throw rugs and clutter. So throw rugs are one of the biggest ways that seniors fall, and they are all over their house because maybe they're trying to hide stains and don't want to replace their carpet. Just try to get rid of them. Rearrange cabinets and shelves so that often reached for items are more accessible and do not require either a big reach, a stool, climbing on counters or chairs. If someone is really insisting on keeping their throw rugs, try to secure them down with rubber backs, or see if you can just put them away for a little bit, either under a bed or in a closet, and when they have guests over, they can pull them out again. But the biggest risk for injury or death comes from falls in the home. So that's about all we have for today. Next month it is Fall Prevention Month, so we are going to be covering more about fall prevention. We did talk a little bit about it today, but it is an important topic that we will be going over. I did want to mention an upcoming event in September through the Caregiver Coalition. It is a fall prevention and safety day. So if you are interested, here is more information about it. Yeah. Do we have any other questions? You can go ahead and chat if you do. Well, if you do not have any other questions, I am always available via email. If you want more information on Elder Help, you can go ahead and email or give us a call here. I will stick around for a few more minutes if there are extra questions, but otherwise, thank you so much, everyone, and have a great rest of your day.
Looked like there was one question that came in asking if there is a PACE program in the Carlsbad area. Not to my knowledge. I think that they are more in the central San Diego, South Bay, and soon to be East County area. So unfortunately, not, but you could always contact the St. Paul's PACE program, and they might have other options for the rest of the county.
Mm-hmm. Someone did ask for me to put up this slide about the upcoming fall prevention event, and here you go. Any other questions? Go ahead and ask.
And this event through the Caregiver Coalition of San Diego is one of several that the group puts on throughout the year. So we've been members of the Caregiver Coalition for several years and try and support their efforts in reaching other family members who are taking care of loved ones that could benefit from additional resources. So some do happen on the weekend and others during the week, but you can always take a look at their website and find out what upcoming events are happening. And that's the Caregiver CoalitionSD.org.
Cool. Well, thank you so much, everyone who joined us today. Like I said, I am available via email if you have other questions that come up. But we'll stick around for a few more minutes if anyone has other questions. Thanks so much.
Thank you.